Well, heart failure diagnostic innovator ESN Clear has also completed a capital raise. This one's a $700,000 investment round via Venture Crowd. Now, the funds will be used to get the technology to market, and to tell us more is CEO Leo De Bruin. Hi, Leo.
Hi, nice to be on the show, guys. Thank you, Elliot. Simon.
Great to have you back on. We talked about you guys last year when you were working through a couple of raises. You've done a couple of crowdfunding programs, and now you're getting ready to take things to market. I know that you're over in the US right now getting regulatory approval. Tell us about that process and when we can expect to see your product in market.
Sure. So, the focus for us is definitely on the clinical validation piece right about now. So we've got a bit of a saliva collection happening at the moment, and then some more kicking off next month. So we're not forcing or pushing the product this year. We definitely want to make sure that the clinical side stacks up because it's such a disruptive area. No one has really done this before. So we want to make sure that there's no skeptics, remaining when we've done the trial. So we focused on the Australian and US markets for the next, let's say, 12 months with our first product, which is a vial kit or a lab test. And the subsequent product would be a electronic device. I'll quickly show you lab test, very simple collection kit, go into a box similar to this one, and then the electronic handheld device, very small and simple, which is electronic test.
Now, I should ask, for people who aren't familiar with what ESN Clear is doing, it's an amazing but simple idea in some ways, but such a vital one because heart failure and heart disease are a massive problem. Tell us how you're tackling this.
Absolutely, Simon. So the big thing here is heart failure. Once you're diagnosed, it's too late. The survival rate is less than 40% within the first 5 years of diagnosis. So really you want to catch it earlier, so before it's actually heart failure, and that's very hard to do. Currently, there's no such a test out in the market, and to be the first in market is usually quite hard. You need to have a lot of proof, and there's lots of skeptics, and that's exactly where we are at. How we are doing it is diligently working through our samples, and we've got preliminary results with our second study, which is better than our first. It's a lot higher than 90% accurate of distinguishing between healthy people versus people at imminent risk or high risk. And the key here is to understand, if you say to someone you're at high risk, everyone post 55 years of age are at high risk. We are trying to pick up people that are not just at normal high risk, that are at imminent high risk, so it's clinically actionable. That's I guess the key word here is clinically actionable, so that a doctor can prescribe a treatment to catch heart failure early and actually save that life.
Because in terms of tackling this, it's a case of sometimes it's as simple as lifestyle changes.
In certain cases, yes. I think if you're very early, it is. But if you are 12 to 18 months away of an event, it might be even too late for a lifestyle change. So I'm not saying don't do the lifestyle change, but you might need some treatment as well.
Yeah. Now, Leo, you have talked about, obviously, as the first to market, there are, of course, skeptics around. But you managed to do this crowdfunding raise on crowdfund. So that's via equity crowdfunding. So it tends to be, general consumers. How did you go about tailoring, I guess, your messaging to get the equity crowdfunding?
Yeah, that's a very good question, Elliot. It is quite hard because, as simple as it sounds, it's actually quite complex science. We've stumped of the major pharma companies where we had to set up many meetings with their science teams to actually step them through what it is. It's twofold. So we do raise through equity crowdfunding. It's fairly simple. It's not large amounts, but it's also not very dilutive. And we do, if you like, dumb it down and just focus on the end result, what it will give you and how it could save your life, not so much what it does. Then we also work on the larger scale big funds. And I guess confidentially, we've just signed a term sheet of $5 million with a medtech fund, so we're working on that investment as well. So we've got two spheres of the pipeline in terms of investment, and it's two very separate conversations. One is very much on what would the product look like and what it's going to do, and if you're talking to the big medtech funds, they want to know the science and focus on the science.
Now, the sobering number in all of this is that 10 million people a year die of heart failure or heart disease. How big is the addressable market as you see it? Is it we all going to get tested, or is it going to be certain people with risk factors? How will it work?
Yeah, so the regulators are specifically looking for, a specific market. They're definitely not going to allow us to test everyone and put everyone on drugs. So what we're focusing on is the 20% of type 2 diabetes patients who are at the highest level of risk. The reason is because we're focusing on a drug class called the SGLT2 inhibitors, such as dapagliflozin, empagliflozin, etc. And what that really does is if you're at a GP's office or at a cardiologist or even an endocrinologist, diabetic specialist, they might do the test and realize that if there is early signs of heart failure, they already know there's type 2 diabetes. And so this one drug will basically help both those situations for diabetes and for heart failure. One drug, so one, what do they say, one stone, two birds.
Now, before we let you go, Leo, I do want to ask about your ambitions. Will you be like our next Cochlear? How big can this get for ASN Clear?
Well, I mean, from our analysis, the sky's the limit. It's a massive market, as you can imagine, and we're definitely not in it just for a quick win. We want to see it through. We're definitely aiming for signing up a major pharma partner this year. We definitely want to draw this out and make the impact that we set out to do in the first place. So, I mean, maybe Cochlear is big, but for some it might be small. I would like to think it's small.
Yeah. Fair enough. Well, thanks so much for joining us from ASN Clear, Leo. We wish you all the best. Put those skeptics out of the way. We look forward to seeing this roll out and to quite simply saving lives. Thanks for your time.
Great, thank you. Thanks for having us. Thank you.
I do note as well in their release, they're expecting to sell these kits for just $100, which does make it quite accessible to people to, if they are worried, if
you're heart curious.
It just becomes part of your regular testing.
I mean, as he sort of said, and I suppose it'll be about scale over time so they can get it there. But just what an amazing idea, what an amazing way to do it through saliva, and just what a massive problem to solve. Just in terms of preventative medicine.
And I can imagine they've got to go, when he's saying, for the retail investors, we say this, then bigger in town, we're going to say the science. So like the science conversation must be quite a hard one to have.
Well, they're having a massive science conversation with the US FDA right now about it. So, fingers crossed for them. They get approval and then it starts rolling out in the US, and I think that'll make a very big difference to the company.